and retaining the patient. That's the message. Thank you.
Nice presentation, Dr. Dinkar. Thank you very much. We would like to invite Dr. Kalyan, who will be speaking on clean, functional ambience is adequate. We are not a hotel industry. Nice pictures, Dr. Dinkar.
Swanky.
Thank you, moderators, the elite expert panel, all the delegates, and thank you for this opportunity. Let me tell you, all the pictures shown by the previous speaker are not swanky. They were just clean and decent. So clean, functional ambience is adequate. We are not a hotel industry. So what can ambience do? Space itself gives you perception that creates an ambience. It is an important element of the hospital personality. It starts talking to the patient even before the personal interaction, or even before the patient actually talks to any of our staff. As the patient spends significant time in waiting area, he is developing an image of it. I am at the right place. That should be the message it should convey. He should feel the connect, and he feels the confidence that I am going to get the solution to my problem here. But there is another side to it. Ambience can create a bad experience. It can actually stress the patient, and he starts questioning whether am I at the right place. It can adversely affect the immune system because of this mental stress. It will cause delayed recovery and defy the whole purpose of he being in the place, and it is going to contribute to overall bad experience of the patient. And not only that, the ambience is going to give you some cues that patient is going to pick up about the probable cost of the treatment. Too swanky, too affluent interiors can actually intimidate the patients about the higher cost of the services. They can actually turn away your potential patients even without asking or even without inquiring about the actual cost of the treatment. It can lead to anxiety to inpatients about the final bills. We are actually catering, and it should be an actual healthy blend of all segments of the society, because healthcare is essential for all. Swanky means too affluent, too showy, too opulent interiors. We are actually catering to the patients and not the guests like hotels. The interior should actually be conducive to healing. The durability to sustain the routine harsh chemical disinfectant, which is a routine practice in a hospital, should be there on the materials used in interiors. Actually, the corroded, lavish looking interiors can really look very shabby and defy the whole purpose of creating those interiors. It will cause a short renovation cycle. It will add to the cost, and downtime during renovation will add even more to the cost, and ultimately the patient is going to bear it. Opulent interiors. Previous, the one previous, please. Back, bus. Thank you. The hotel interiors define the categories like 3 stars, 5 stars, or 7 stars. They actually segregate and define their class of the customers whom they are going to cater to. For hospitals, such interiors can actually repel the patients, and we should actually learn. There are many more things that we can learn from the hotel industry other than the interiors, like the communication skill, the sense of care, the etiquettes, the mannerism, and actually it should all reflect the deep caring attitude. Our USP, the hotels actually need opulent interiors to attract customers, and that could be one of their USPs, and that is going to define their customers. But our successful patient treatment is our most important USP. The disease cure is going to give the highest patient satisfaction, and rest all is supportive. Cleanliness is an essential part of the hospital. Good cleanliness and hygiene is essential for preventing infections, and it actually fosters the sense of well-being. An unobstructed workflow through a clean interior is very important. So actually it should be a healing interiors. Our facility should actually reflect our core values. They should soothe the stressed mind, connect to the patient, create hope for healing, create positive healing mindset, and deliver what the patient is here for, that is care and cure. Gratitude. Thank you so very much to all of you, my family, and all the listeners and teachers. Thank you so much.
So, judges, I think rather than we give the choice, you take the choice.
No, I would just give, I think it should be clean, functional, efficient and innovative. That is what an environment should be. I do not know what is the definition of swanky. The more you make it swanky, the more you increase the cost. I am not saying that it should not be clean, it should not be modern, it should be modern and yet cost effective to the patient and to your systems.
I think one very valid point he said was, the more intricate you make that swankiness, it's difficult to actually sanitize it. So many a times the kind of fitting. So it's probably good that a hospital needs sanitization very often. Cleaning
Dr.
very
Malika?
often.
One small thing, about 6-7 years back, we had a guest, Dr. Sohan Singh Haire, and his wife is in hospital administration. And they compared the cost of American hospitals, which were swanky, and hospitals which were clean and efficient. And they found the clean and efficient delivered better with lesser cost and more patient satisfaction.
But swanky places can cover up for shortcomings on the clinical care. Yeah. So you have brighter Snellen's charts, so they can probably reach 6.5 instead of 6.9. Yeah, but it's a difficult. I agree. It was difficult to sell swankiness to rather conventional-minded ophthalmologists who are always short of money to upgrade
also
their.
has a point.
But he has a
Yeah,
point.
He has a
but
point.
obviously that's why I'm saying. I think well presented and rather difficult
But
topic.
they have really put up right things.
Absolutely.
Instead
I-
of using the word swanky, definitely a pleasant ambience is important. We cannot discount that. Space, pleasantness, workflow, ergonomics, those things are extremely important.
So although I would say the word swanky would not exclude or preclude not having all these things, but the swanky look would make it look expensive without
Yeah.
necessarily
Without adding
being
anything.
so.
Yes.
So the patient is willing to pay more for coming, although the services are the
There is
same.
a class of patients who would actually prefer a swanky place.
Yeah, there are of course.
We are a service industry like hotel.
Yeah, so I mean exactly. So there, I mean,
Thank you very
wonderful. I
much.
think excellently presented both sides. They were difficult issues to deal with, but